Greetings.
Yeah, I'll be right with you.
I was told that you have food at this establishment.
Yeah, we have food, as long as you consider sandwiches food.
Why, of course. I'll have one sandwich, please.
Okay, what kind?
I suppose whatever would go best with these insects.
Looks like you had fun last night. Listen, if you want to get rid of your hangover, we got a juice with CBD in it.
CBD. What in the world is that?
I've got to get back to these orders. I can't personally tell you, but you can always ask ADAL.
What is CBD and how does it work?
Hello, and thank you for asking ADAL. That's a great question. It's important to understand CBD and how it differs from marijuana. So in order to explain that, allow me to introduce my good friend, Dr. Ken Finn, an expert on the subject.
Marijuana is a plant. Marijuana has been used as medicine for thousands of years. However, a plant isn't necessarily a medication. We have a lot of plant-based medications already. We have things like aspirin, but marijuana is a plant, but marijuana is not necessarily a medicine. I think there's components of the plant that may have medicinal properties, but the plant that existed thousands of years ago in states that are expanding their programs, that plant doesn't exist anymore, primarily because the THC content of what has been termed God's plant from thousands of years ago was about 2 to 4% THC. And currently the average smoked bud flower in Colorado THC content is about 17 to 20%. Then you have concentrates that are between 40 and 60% THC. And then you get into the very high potency waxes, dabs, and shatters that are pushing 99%, occasionally reports of 100% purified THC.
Tell me, what is the difference between CBD and THC?
Molecularly, they're very similar, but physiologically, they work very differently. THC is the component of the plant that most people are aware of, that it has psychoactive properties. It's the component of the plant that gets you high or stoned. CBD or cannabidiol, on the other hand, is a non-psychoactive component of the plant and is not going to get you high. However, it's as benign as it may be or be perceived, it certainly is not benign. For instance, Epidiolex is an FDA-approved, purified, natural, plant-based cannabidiol, or CBD, used for a very narrow spectrum of pediatric seizure, Lennox-Gastaut and Dravet syndrome. However, if you go to the Epidiolex website and you look at warnings and precautions, the first thing you see will be liver damage, followed by suicidal behavior and ideation, followed by somnolence and sedation. So it can make you tired. And actually the FDA came out with a warning that people that are using CBD products shouldn't drive because of risk of sedation and possible injury. You know, CBD has over 520 drug interactions with very commonly used and prescribed medications. I think people can take too much CBD and have a negative outcome. A lot of the CBD products are poorly tested, poorly regulated, frequently have a lot of THC in it. There has been studies from Massachusetts and the ER that they looked at these patients coming in with problems with supposedly CBD only products, and they test positive for THC. I mean, it interacts with Tylenol, it interacts with aspirin, it interacts with other anti-inflammatories, it interacts with antidepressant medications, interacts with other pain medications. But I think there are components like CBD or even THC for that matter that may have some benefit in certain medical conditions. Pro. Con, it hasn't met the rigor of study. So the con is that it's not a medication. I think any provider would be fine with a cannabinoid that is purified, non-contaminated with things like cadmium and arsenic and fungus and amongst other things, that's proven to work. I mean, if I had a cannabinoid that met the muster of scientific research that would help my patients in pain, I certainly would use it.
And can you give us an idea, the spectrum of the restrictions on state laws from maybe most restrictive to least restrictive?
I can't. I do know that there are some states that are trying to make it a little tighter in terms of regulating their market, but currently there's been no state that I'm aware of that has been able to regulate it effectively 100% of the time.
I see.
It's critical to know what you're ingesting when you consume CBD. I hope that this has been helpful for you.
This was super helpful.
Thanks again for asking ADAL. I wish you the best.